Hey guys, Nick Sivrich here. I'm a physical therapist and I wanted to go over this week's question of the week with you. So this is a pretty common question I get, mainly from patients or actually from people that are thinking about coming to therapy or really don't know much about it. And this will also be one I get from people that I usually evaluate on the first day. But they'll ask me, how long do I have to come to physical therapy? And I'll usually tell them, well, it really depends on the condition, especially if it's not a patient that's here, if it's just someone that I'm talking to randomly, whether it's a friend, a family member, or someone I've just met. But they want to know how long. And, you know, it all really depends on the condition. So, you know, a good average usually, you know, for someone that just has, like, say, for instance, they tweak their back, raking leaves or picking something up, you know, without a definitive diagnosis. Usually you see someone for that anywhere between 4 to 8 weeks, I would say. You're going to get a pretty good understanding as to where they're going to be going in their treatment if they're responding well. You know, there's other types of surgeries such as total knee replacements. Usually on average I see people anywhere between 6 to 12 weeks for that. Rotator cuff repair and ACL repair reconstruction are the absolute longest. Usually ACL, I'll usually see people anywhere between 6 to 9 months, sometimes a year, depending on if they are returning to a high level, if it's a high level athlete or a sport that they're trying to return to. And rotator cuff repair, it depends. If it's someone that's very old, not very old, but someone that doesn't have a high demanding job or life, if it's someone that's retired, usually I'll see someone for post-rotator cuff maybe for 4 or 5 months. As long as they're able to, you know, do everything they want to do at home, they're putting on their clothes correctly, they're able to lift up and, you know, get a coffee cup, and as long as they're happy, you know. If it's somebody else that has a high demanding physical job, like a construction worker or even, you know, like a pitcher, a high school pitcher or something like that, you know, you're looking more on the lines of 7 to 9 months where you're going to be seeing me and you know, returning to your activity. But there's like a big wide spectrum, you know, so, you know, you figure you could be seeing me for 4 weeks, you could be seeing me for 9 months. And like I said, it really all depends on, you know, the type of ailment that you have, the type of injury or diagnosis or, you know, general problem that you're having with me. So I hope that helps. I hope I answered your questions. If you have any questions, feel free to contact me. You know, subscribe to my channel as well as like my page on Facebook at PT Answers Now. You can also check out my blog at nicksivrichpt.com. You can ask me any questions there. You know, shoot me an email, shoot me a message on there. I'll be glad to answer anything you have. So see you guys later. Thanks.